He wouldn't take his medicine, he would sleep all day.
It would lead me to either institutions or death.
If they hear that you have a mental illness, it's like, we don't want your kind here.
When he was first diagnosed, it was very difficult for Michael to leave us, especially when we had to tell Michael he couldn't come home.
When an increasing number of people are released from hospitals, they can often end up in jail, in shelters, or become homeless. It costs approximately $350,000 a year to hospitalize someone in a state-operated psychiatric center. By some estimates, it costs $350,000 to $400,000 a year to hospitalize someone in a local acute care hospital, and as much as $65,000 to $75,000 to incarcerate someone with a mental illness in New York State jails and prisons.
We need more mental health beds. We need more community residences for people who are mentally ill, and a mental health shelter system that works.
But existing community residences are woefully underfunded. We can't add more without preserving the ones we have.
People who suffer mental illnesses who go without treatment are at the highest risk of suffering the worst of the complications of mental illness.
Agencies are best suited to provide supportive services anywhere from $7,000 to $40,000 per year at most. But organizations are facing deficits, forcing them to give up beds. Funding for residential programs have not kept pace with inflation.
My staff is made up of educated professionals. The government or the powers that be need to understand that they deserve a wage that compensates them for the level of work that they do.
These are the people who we want to retain in the field. It's difficult to do so, though, because of the lack of funding.
The Bring It Home campaign is about funding for housing and services. Adequate funding protects the most vulnerable New York State residents and saves taxpayer dollars. We need your help now. Support and sign on to our campaign.